So yeah, today I'm going to discuss about the topic of antipsychotic drugs. So first of all, myself, I am Arvind Selvam, Assistant Professor, Department of Pharmacology. So in that psychopharmacology, there is so many agents involved in that psychopharmacology agents. The chemical substances that primarily affect the mental processes and changes the brain function and result in the alteration in the perception, mood, consciousness, and conjunction of behavior. So there are so many psychopharmacology agents are classified in that into many of the types. The first one is antipsychotic drugs, that is also called as neuroleptic. These drugs are used to treating schizophrenia from other psychosis disease. Um, and anti Second one is anti-anxiety agents, that's also called as anxiolytics. These drugs to diminish pathological anxiety, tension, and agitation without affecting other behaviors. And third one is antidepressant. These are the drugs to use in endogenous depression. And fourth one is anti-manic drugs. These agents are used for prophylaxis in bipolar depression and manic phase of the disease. And the fifth one is psychostimulant. These agents to have relative specific effect and mesolymphic system, and this increase the mental alertness and behavioral motivations. And sixth one is hallucinogens. These drugs to induce the psychotic symptoms and hallucination. So now we are going to discuss about the first topic on antipsychotic. The antipsychotic drugs are mainly used for treatment of schizophrenia. However, they can also be used in mania. These drugs are also called as a neuroleptic or major tranquilizers because they reduce the agitation and disturb the behavior observed in patients in schizophrenia. Schizophrenia is one of the major form of psychotic illness which affect the young people is often chronic and high disabling. There are so many symptoms are produced by the antipsychotic drugs. There is a first positive or negative symptoms are there. First one is positive symptoms. What are the positive symptoms are produced by the psychotics? First one is a delusion, hallucination, and disorganized thinking and speech, and extremely they are disorganized or abnormal motor behavior. And negative symptoms are loss of conduct from the outer world and flattering of emotional responses. There are so many drugs to classified in that various category of chemical derivatives. The first derivative is phenothiazine. The drug example for that phenothiazine derivatives is chlorbromazine and trifluoroferazine. And second category is butyrophenones. Drug example for haloperidol and trifluperidol. And third category is Ravalfia alkaloids. These are the alkaloids obtained from the Ravalfia wood. Drug example reserpine. And third category is indole alkaloids. Drug example is malingol. And fifth category is thiazanthine. Drug example for that category chlorpherazine. And sixth diphenylbutyl pyriferinins and thymosid and fenfluotriol. And sixth category is benzamides. Benzamides drug example is sulfuramide and amisulfuride. The last category of neuroleptic is atypical neuroleptics. There is a drug example is clozapine and olanzapine and risperidone. What are the mechanisms involved in the antipsychotic drugs? The major of all psychotic drugs except clozapine and risperidone act by the blocking the D2 receptor in the brain and periphery. So what are the pharmacological actions in that antipsychotic drugs? In CNS, they decrease the irrational behavior and agitation and aggressiveness and disturbed thought and behavior. ANS effect is effect of antipsychotic agents are complex and unpredictable. Some of the drugs, atypical antipsychotic drugs, clozapine and drugs have particularly significant alpha adrenergic blocking activity, and say CVS system, neuroleptics produce hypertension and high doses of CPSs directly depress the heart and produce ECG changes. Arrhythmia may occur in overdose. Local anesthetic CPZ is not useful for due to the irritant actions. Um, Endocrine increases the prolactin release by the blocking the inhibitory action of dopamine, and skeletal muscle neuroleptic due to the produce any effect on muscles fiber or neuromuscular transmission. What are the therapeutic uses of antipsychotic drugs? It is majorly used for the schizophrenia patient and manic depressive illness or behavioral disorders and anxiety, severe drug-induced nausea and vomiting or hiccup. That is, the drugs are also used for the pre-anesthetic medication. What are the adverse effects produced by the system wise? First system is CNS. CNS they can produce the drowsiness, lethargy, mental confusion, appetite and sedation, memory impairment and Parkinsonism. And CVS, postural hypertension and arrhythmia and sudden cardiac death. And third category is anticholinergic effect, dry mouth and blurred vision, constipation and urinary retention. And fourth category is endocrine system, that is produced by the hyperprolactinemia and lower the gonadotrophin level. Uh, there is a hypersensitivity reactions of the skin rashes and urticaria, dermatitis, and photosensitivity reaction. And sexual dysfunction is produced by the some type of antipsychotic drugs, and other some of the other adverse effect is acute dystoniasis and akathisia and obstructive jaundice. There is produced in that video. We discussed about the what are antipsychotic and what are the symptoms are there, and what are the drugs used for the antipsychotic drugs, and what are the mechanism action involved, and what are the adverse effect and therapeutic uses of antipsychotic agents. Thank you.